My name is Murali Bhat. I'm a consultant hand surgeon. I have a 30-year experience doing hand surgery, of having done more than 1,000 carpal tunnel operations in my career. So carpal tunnel syndrome is an extremely common condition. It's one of the most common causes of pain and tingling in the hand and arm. And essentially it affects a nerve that goes through a tunnel in the wrist, which then causes severe pain affecting either just the wrist or the whole arm. It causes night symptoms, regularly wakes you up. It's actually quite a distressing condition because of the level of pain it causes. The diagnosis of carpal tunnel, it's an easy diagnosis and a difficult diagnosis depending on the type of presentation. Some people come with symptoms that are textbook, but there are many who don't have textbook symptoms and they'll present with pain that can be unusual. Sometimes you can have just shoulder pain, sometimes just elbow pain, and so that's why you need an expert to assess it. And most of the time the diagnosis is made based on the history and clinical examination, which is where the experience comes in. Some mild cases of carpal tunnel can get better without treatment. Some get better with splints on the wrist. Some get better with anti-inflammatory tablets. Some get better with steroid injections. However, there are many patients who have tried all of these things and have still continued to suffer with symptoms, and those are the ones who are ideally suited for carpal tunnel release surgery. So there are three different ways in which the carpal tunnel can be released. The standard approach is something called an open carpal tunnel release, which a lot of doctors will offer. That involves a long cut, which is about 4 centimeters long in the palm all the way to the wrist. The second approach is called an endoscopic carpal tunnel release, in which 2 small cuts are made at either end of the carpal tunnel, and an endoscope is used to see the nerve and the tunnel. The third approach is where you use a very small cut at one end of the carpal tunnel, and you don't use an endoscope for that, and this is the approach that I favor. We have made some good patient information leaflets and videos to explain everything you need for carpal tunnel surgery, because there's so much information that we'd like you to have. The main points are that the operation is straightforward. You'll come in, you walk in and walk out for the procedure. You're here for half an hour to an hour at the most. We put a local anesthetic to numb the area for the incision. It's extremely well tolerated, and there's no need to be afraid of having it done wide awake. You will have a sling that's given after the procedure to keep your hand elevated for about a week. So at 1 week, we like you to take off the bandages, and we also like you to see one of our specialist hand therapists who are very experienced at advising you how to look after that wound in the early weeks and months. Carpal tunnel surgery is a reasonably safe procedure. We do a lot of these operations. There are instances where you can get sensitivity in the scar that lasts a lot longer than usual. That's called pillar pain. Probably be the #1 complication to look for, which is the reason why a hand therapist is helpful, because they help you prevent this complication. The other complications are extremely rare. Stiffness of your hand, nerve damage, infection, are like 1 in 100 to 1 in 700 risk of these things happening. Carpal tunnel surgery is the most certain way of putting an end to your misery. 1 in 1,000 people who have carpal tunnel operations will come back in their lifetime with carpal tunnel syndrome again. In the video that we provide you before the operation, there's a lot of information about this, because the question comes up a lot. In general, if you're doing administrative tasks, desk work or such like, then you could be starting that within days of the procedure, typically no more than 1 to 2 weeks after the operation. But if you're doing anything manual, then because the scar is at a place where it can interfere with your grip and leaning onto it, you'll struggle for about 6 weeks. There are different symptoms with carpal tunnel. So the 3 things that patients suffer with usually is pain, numbness, and weakness. So pain goes away on the night of the operation, so it's absolutely miraculous in that respect. So if you've been suffering with sleepless nights, you'll have your first night of good sleep on the night of the operation, so that's great. However, the other bits will remain for a time. Things like tingling in the fingers or numbness, weakness of your grip will take weeks to months to improve. That this operation requires a general anesthetic. Actually, I can't remember when I used a general anesthetic to do a carpal tunnel operation in the last 10 years. Another misconception is that I can't have both my hands operated on together. I've done lots and lots of patients with both hands together, and they haven't regretted it. And that another misconception is that it's fraught with complications. I can assure you that that's not true either. So firstly, I would recommend that you arrange a consultation with the consultant. So I would see you for half an hour and tailor the advice specific to you. In the last 5 years, since COVID, new techniques have come in, especially with the anesthetic, in which we're now able to do carpal tunnel surgery very elegantly outside the main operating theatres in outpatient settings. So I've pioneered about 200 to 300 carpal tunnel operations in the outpatient settings already, and we are now planning to offer the same service at the Well Life Clinic, in which your carpal tunnel pathway, including the surgery, will be consultant-led and delivered from start to finish. It'll be a walk-in, walk-out service, which means it's accessible nationwide at a very affordable cost.